Hello and welcome to the series of online training modules on parents with disabilities in child welfare. My name is Mingyang Zheng. I'm a doctoral student at the School of Social Work, University of Minnesota. This training is a collaborative effort between faculty at the University of Minnesota School of Social Work and the Center for Advanced Studies in Child Welfare at the School of Social Work at the University of Minnesota. This training module is part of an online training effort that covers a wide range of topic areas in child welfare. This training module, supporting parents with disabilities in clinical and macro practices, has two parts. Each part is about 20 minutes. In part 1, we will talk about how to support parents with disabilities in clinic social work practice. In part 2, we will talk about how to engage in policy advocacy work to support parents with disabilities. By completing this module, you may be able to earn continuing education unit. You will be given an option at the end of the training to sign up for CEUs. If you choose to seek CEUs, a quiz will be offered that must be completed successfully in order to be given credit. The quiz will cover content from the entire training, including any additional documents, videos, and external links that we ask you to access. This module contains some additional files for you to download in Adobe Acrobat's PDF format. Adobe Acrobat is a free document reader that you will need to have on your computer. You can download it for free from the link on this page, and you will also find links that will take you to external websites for further reading and information. For the Part 1 online training module, supporting parents with disabilities in clinical social work practice, there are three learning objectives. People who complete this training will be able to be aware of the available entitlements for parents with disabilities, understand the available supports for parents with disabilities, and be familiar with the service models for developing interventions for parents with disabilities. Before we get started, let's take a minute to think about this question. Why is it important to provide supports for parents with disabilities? When I ask this question, some of the common responses are social work mission and code of ethics. It is our mission to work with disadvantaged populations, and because of the code of ethics, we have the ethical responsibility to help parents with disabilities and advocate for them, right? And study also show that there is a link between parental socio-economic status and child development. Children who living in a low socio-economic status family are more likely to repeat the same path in the future. And it is not difficult to imagine that parents with disabilities are more likely to have low socioeconomic status, right? For example, they may constantly encounter different types of discriminations and financial problems. Let's take a look at the background information about parents with disabilities. People with disabilities have historically faced many barriers to achieving reproductive freedom. Eugenics was a popular science in the United States and much of the world during most of the 20th century. So, what did they do? People with disabilities were routinely sterilized involuntarily. For example, Indiana is the first state to pass the sterilization law in 1907, which authorized medical superintendents to sterilize people who were criminals or physical or mentally disabled. California, Washington, and along with other 30 states also passed eugenic sterilization laws. Unfortunately, today parents with disabilities are still unfairly treated due to the discriminatory policies. For example, parents with disabilities can involve in child welfare and have their children removed through termination of parental right. A study conducted by Delzela and Lightfoot found that among all termination of parental right cases, 19% of the termination of parental right cases listed parental disability as one of the reasons for removing a child from his or her parents. About 5% of these cases, parental disability is a sole removal reason. Also, parents' disability status may have impacts on children's length of stay in foster care. When parental disability is only removal reason, children usually stay a longer time on average in foster care compared to those removal cases that parental disability is one of the removal reasons. We have talked about this in other online learning modules. If you are interested, you can click this link for more information. Although parents with disabilities are overrepresented in the termination of parental right cases, there is no evidence to support that they are more likely to abuse or neglect their children compared to other parents. While reviewing the studies related to this area, we found that evidence is mixed. Azar, Stevenson, and Johnson found that parents with intellectual disabilities appear to be overrepresented in the Child Protective Services system and were more likely to be labeled as neglectful. However, intellectual disabilities alone do not lead to higher risks of child maltreatment. McGowan, Scowley, and Pritchard found that parents with intellectual disabilities with physical and or sensory deficits are more likely to abuse and neglect their children compared to parents with intellectual disabilities with poor mental health. Lightfoot and Slater found that parents with disabilities self-report a higher rate of a range of parental-related risk factors that are commonly associated with child maltreatment than parents without disabilities. However, they argue that because the pathway of maltreatment risk is unclear, we cannot simply interpret the findings as parents with disabilities are more likely to abuse their children. Considering the challenges of parents with disabilities are facing, as social workers working in child welfare system, what can we do to support them in clinical practice? Here, I'm going to talk about the entitlements that parents with disabilities might be eligible for, types of support or interventions that might be useful to promote family functioning, and the guidelines for developing services model for parents with disabilities. In terms of entitlements, first, we will talk about Social Security Disability Insurance. It is also known as SSDI, and it is administered by Social Security Administration. SSDI is a monthly cash benefit for people with disabilities who have worked for a certain number of years and have made contributions to the Social Security Trust Fund. So, how much a person with disabilities can get from SSDI is not depends on how severe the disabilities conditions are, but how much that person has contributed to the Social Security Trust Fund. According to the Social Security Administration, the average SSDI benefits is about 1,200 a month in 2016. There are several ways to apply the SSDI. It can be applied online by going to the www.ssa.gov or apply at the local Social Security office. For more eligibility requirements, you can visit this link. Next, we will talk about supplemental security income, also known as SSI. Don't confuse SSI with SSDI, which lots of people do. Yes, SSI is a cash benefit, but one major difference between SSI and SSDI is that SSDI is for people who have worked and have paid into Social Security. SSI is for people who have not paid enough in and who have low income and assets. The maximum amount for a single person can get from SSI is 771 in 2019. It is important to know that people who receive SSI may run the risk of losing it if they have other source of income. For example, SSI counts half of their earned income. So for every $2 a person earns, SSI will go down by $1. And if a person's monthly income exceeds a certain limit, the person will lose the SSI completely. Some people criticize that SSI traps many disabled people by limiting their income to the level just above the poverty line. So if you are interested, and you can click this link and read about the article on New York Times. Now let's talk about Supplemental Nutrition Assistance Program. It is also called SNAP. It is a monthly cash benefit paid on an EBT card that can be used to buy food. It is for people with or without disabilities who have little or no income or assets. It is a federal program administered by county human service agencies. In Minnesota, people can apply online at applymn.org, or people can also fill out a combined application form or contact the county human service agency to apply. There are some other cash benefits, such as Minnesota Supplemental Aid. It is a cash benefit that help people who get supplemental security income pay for their basic needs. MSA can also provide cash assistance for people who are ineligible for SSI because their other income is too high. And of course, people should meet the income eligibility of MSA. General assistance provides cash assistance to people who are unable to work and those income and resources are very low. People who get GA are also eligible for help with medical and food costs through medical assistant and supplemental nutrition assistant program. The housing support program provides payments for room and board for older adults and adults with disabilities who have limited incomes. The goal of the program is to reduce and prevent people from living in institutions or becoming homeless. The Minnesota Family Investment Program provides families with children with cash and food assistance while helping parents move to financial stability through work. Parents are expected to work. Most families have a lifetime limit of 60 months on the Minnesota Family Investment Program. For more information, you can click the link below to read through the eligibility and application process. Healthcare is essential to parents with disabilities. Medical assistance is known nationally as Medicaid. It's an insurance for people with disabilities, low income, children, and others. It is a federal program delivered by the states. The income and asset limits are different for different groups of people. It covers the medical expenses such as hospital care, doctor visits, and personal care attendant services. For parents with disabilities to receive medical assistance, their disability status should be determined by the Social Security Administration or the state medical review team at the Minnesota Department of Human Services, and they should meet other eligibilities. Parents with disabilities may be also eligible for Medicare. Medicare is a federal run health insurance program. It provides coverage for people aged 65 or above and people with disabilities who get SSDI. In other words, for parents with disabilities to be eligible for Medicare, they should receive SSDI first, meaning that they should have contributed to the Social Security Trust Fund. Medicare is administered by Social Security Administration. There are three parts to Medicare. Medicare Part A is for hospital coverage. Medicare Part B is for things like clinic or doctor visits. And Part D is for prescription drugs. Next, let's talk about housing benefits. Housing is a significant barrier for people with disabilities. People with disabilities are disproportionately represented among all people experiencing homelessness. In fact, at least 43% of homeless adults in the shelters identify as people with a disability. Thus, when working with parents with disabilities, it is important to address their housing needs. Here are some possible housing resources that parents with disabilities might be eligible for. First, Section 8. The Section 8 Housing Voucher Program is a rental subsidy program administered locally by public housing agencies. A family that is issued a housing voucher, the public housing agencies will pay the housing subsidy to the landlord directly, and the family will pay the difference between the actual rent charged by the landlord and the amount subsidized by the program, which is about 30% of their monthly income. The second one is public housing. Public housing is rental housing for people with low income that is owned or managed by public housing agencies. People who are qualified for the public housing will pay 30% of their income on the housing. There are different sizes and types of public housings. And the third one is housing support. As we mentioned in the previous slides, the housing support program provides payments for room and board for older adults and adults with disabilities who have limited incomes. Next, we will discuss different types of support for parents with disabilities. Specifically, we will look at parent education program, group parenting, social network, assistive devices. Parent education programs are usually designed to improve the skills of parents and enhance their ability to support their children. Unfortunately, there is no national-wide parents education program that is specifically designed for parents with disabilities. There are, however, some programs have great potential to support parents with disabilities. Head Start is a good example. Head Start staff can play a critical role in offering friendship and support for parents with disabilities. Parent education program can be very helpful for parents with disabilities. Studies show that parents with disabilities respond to social supports and supportive services and training can make a difference in maximizing competent parenting. It is worth noting that home environment is beneficial for teaching and learning. Group intervention is useful for parents with disabilities because it expands parents' social network. A study showed that after 3 months of program participation, mothers usually feel less social isolation and parenting stress. Study also showed that group participation can change for the better the self-perception, social support network, and quality of life of mothers with disabilities. Social network is another important support for parents with disabilities. Research findings have been showing that the size and the quality of social networks impacts parenting. Assistive devices such as wheelchair adaptive stroller can maximize parents' functional performance. However, the research showed that parents face barriers in accessing the right assistive devices and face barriers with regards to the understanding of human service professionals on the importance of assistive devices. Study also showed that lack of assistive devices affects parenting responsibilities. Next, let's talk about some service models that can be used to develop service programs to support parents with disabilities. McGow and Sturmey placed a lot of emphasis on having a comprehensive assessment before implementing interventions for parents with disabilities. For example, assessing parents' ability to provide care for their children should not be based on IQ tests, but should be assessed based on parents' practical and social judgment, their relationship with their child, prior experience with children and exposure to stress, and the level of social support. To conduct a comprehensive assessment, social work practitioners need to assess the receptiveness of parents to interventions to improve parenting skills, assessing parents' mental and physical health. The characteristics of the child is also an important factor. The majority of children of parents with learning disabilities will be of higher intelligence than their parents. As a result, they may be perceived as difficult to manage by their parents. Social support is also important. The best support is that offered on a daily basis. All support needs to be long term for some parents who continuously seem to be in crisis, both domestically or psychosocially. And many need guidance in area of children rearing as child successfully negotiates with new stage of development. When conducting home assessment, it is not just looking at the socio-economic status of the family. It is also important to look at the family interactions. For example, do parents with disabilities interact with their children? Do children interact with their siblings? Woodhouse, Green, and Davis suggested a four-tier model. The first tier is to provide an ongoing series of workshops for professional groups involved or potentially involving parents with disabilities. The second tier is that professionals engage in informal assessment of the family. This is to identify early problems with families and share available services to the family. The third tier is to conduct formal assessment of the family, such as their parental skills. The last tier is to implement interventions that address a range of issues from child care skills to personal development. The last one is support interview guide. This is more of a interview guide rather than a service model. But the framework of developing this interview guide can shed some light on how service model for parents with disabilities should be developed. The interview guide focuses on three major areas, which are support network and type of support. Lastly, closeness to support network. It is important to note that when working with parents with intellectual disabilities, practitioners need to use appropriate language to assess parents' needs. Please visit the following website and browse the support interview guide. Either click on the link to get the website or cut and paste the link. To sum up, in this module, we discussed different types of entitlements. We talked about types of supports. And lastly, we discussed different service models that can be useful for developing interventions. In the next module, we will talk about how to advocate policy change to support parents with disabilities.